Welcome back, everyone, to Cheddar. International health authorities are on high alert following a newly identified virus originating in China. The total number of confirmed cases of the coronavirus has risen above 300. The virus has killed 6 people in China, but it has not been contained to that country. The first coronavirus case in the U.S. has now been identified in a person traveling from China to Washington state. Joining us now, infectious disease expert Dr. Amesh Adalja. It's great to have you with us. So what exactly is the coronavirus? How is it being spread? What do we know about it right now?
So coronaviruses are a well-established family of viruses that are responsible for about 25% of cases of the common cold. But in that group of viruses are some that are very severe, like SARS, which circled the globe in 2003, and Middle East Respiratory Syndrome, or MERS. And what we have in China now is the discovery of a novel new human coronavirus that is spread through the respiratory route and maybe also spread from animals that has caused some severe illness and caused some deaths.
Okay, what kind of animals are we talking and what is the treatment like?
So there is no specific treatment for coronaviruses. There's no antiviral, there's no vaccine. And the animals that can spread coronavirus can range from, for example, bats, where all these coronaviruses likely originate, to cats, to other wildlife. And we know initially that this outbreak was centered on a market in Wuhan, but that may not be the case. And it may be what's happening now is it's spreading from person to person, and the animal part of this may not have been really the origin of this.
Compare and contrast the severity of the symptoms of the consequences of contracting this versus SARS, that we had seen that outbreak in China before.
So this doesn't seem to be as deadly as SARS. SARS killed about 10% of those that it infected. We now have about 6 deaths from this virus, so it doesn't seem to be that severe as SARS. But we don't really know all of this yet because it's early days in this outbreak, and we don't really know what's going on the ground. We know that the case in the United States is recovered and it's clinically stable and is really not being in the hospital because he needs any kind of hospital intervention. So for what we're hearing, this may have a mild component to it, but there clearly have been severe cases, and we need to understand what causes these cases to be severe.
And so here in the United States and abroad, this has led airports to also have to undergo some type of protocol for how they are adequately identifying and then triaging appropriately as well. What action have you seen? Where can we see even more action from airports to be proactive to the extent that they can in a scenario that is very much reactive at this point in time?
Right now in the United States, we have been proactive. They've been screening for a couple of days now at airports such as LAX, San Francisco, and JFK. However, what we'll see in coming days is you might see stepped up screening and people being diverted to other airports where you will see more screening being done, looking at patients with fevers, looking at symptom questionnaires, and then testing those patients to see if they've been exposed. We certainly have seen this in other countries that are neighboring China, and we have had cases diagnosed in places like Thailand and Japan. And I expect this to increase over time until we get a handle on how severe this infection is and what level of risk it poses to the world.
And the CDC's already said it's looking for some type of treatment and solution for this, as well as we know that this is, again, now spread to outside of China. What about where we see this growing potentially? We have the Lunar New Year holiday coming up, as I mentioned earlier. Hundreds of millions of people, I mean the entire population basically of the United States, moving around during this 2-week period. Is there any hope that we can get from the Chinese government to say that they've been able to at least minimize what that contact could be from person to person as they're traveling?
It's very hard to do that because viruses love to exploit our travel patterns, and we right now don't know exactly how contagious this is from person to person. And that's a big variable because if it is a rare event when it spreads from human to humans, that's one thing and makes something easier to control. But if it's easily transmissible between person to person, then it becomes very hard to control, and the Chinese Lunar New Year travel will be an event that this virus could exploit to spread more widely. And I do expect we will see more cases.
I think a huge question when you hear about where this is originating from and the countries impacted thus far, the spread of contamination or contamination of products that are produced in those countries, is there any potential spread through production? I think about just made in Taiwan and what we see on so many products that make it here that are exported from Taiwan to the U.S. And same in China and similarly. Is there any product contamination we should be aware of?
there's no evidence that there's product contamination. If this is spreading to other countries, it is through people, not through products.
And what should you do if you're thinking about traveling, if you've already bought tickets, let's say that you're traveling to some of these countries in areas like the state of Washington where you already see a case? Should you cancel your flight plans or travel plans?
No, I don't believe you should cancel flight plans, especially to the state of Washington. That's not really a risk that the average person will face from this virus in the state of Washington. If you're going to China, I think it's prudent to avoid the live markets where this may have originated, and also to avoid healthcare facilities and sick people as best you can, and practice good hand hygiene. Wash your hands and practice good cough etiquette. Just the normal basic stuff for this virus.
The CDC had said so far that they've screened more than 1,200 travelers. No individual's been referred for more testing, but they are expecting more, as we mentioned earlier. How long do you think they will have these protocols in place? And do you think that they'll be heightened should we see even more cases emerge?
I think in the short term, it will be heightened because there's a lot of uncertainty about this virus, so they want to really understand what's going on before we kind of move back to things as normal. The key question is how severe is this infection? We're hearing about severe cases in hospitals and deaths, but we're not hearing so much about the mild cases. It's really important to understand what the spectrum of illness is. And is this behaving more like the coronaviruses that cause the common cold and occasionally cause pneumonia, or is this behaving more like SARS and MERS, where you have severe illness? And once that spectrum is defined, I think then you will start to see the risk being adjusted, the risk level being adjusted, and certain precautions either being increased or decreased based on what we actually know. And many of this information, most of this information might come out at the WHO meeting tomorrow, where they're going to discuss this virus.
And really quickly here, what are the symptoms that if you feel sick that you should go into a doctor and check yourself into? And then also, are most doctors now equipped to be able to test to find that this is the disease that somebody might have?
The symptoms of this are really the same as the cold or the flu. So fever, cough, sore throat, runny nose, maybe some shortness of breath. And lots of people are going to have those symptoms because we're in the midst of flu season right now, a particularly severe flu season. So it's very hard to distinguish that. But if you have traveled to those areas, to Wuhan in China, I think you need to tell your physicians and tell your healthcare providers you were in that area so that they can take the appropriate precautions. Testing is right now centralized, being done by the Centers for Disease Control, and maybe some state health departments are beginning to have that capacity. So the testing is something that you have to send to the CDC or other public health authorities until we get a rapid test that can be used more widely.
Just quickly, while we have you, you mentioned the World Health Organization, and they're meeting tomorrow to decide whether this is an international public health emergency. How frequently, what are some of the other cases where we have seen them actually go about declaring this?
Well, this is a mechanism that came into place after the SARS outbreak, and we've seen them declare it, for example, for Ebola, for polio, for Zika, for the new Ebola outbreak in the DRC that's going on. So this is something that's rarely used, and what it does is it galvanizes public health authorities around the world to draw their attention and their resources to containing this outbreak. And it's unclear right now which way they'll go with this, but I think it's worth them having this meeting and really discussing what the open questions are.
All right, that's great background for us and for our viewers as well. Infectious disease expert Dr. Amesh Adalja joining us here today. Thank you so much for the time.
Thanks for having me.